food is the most critical choice you make 3 times a day and 21 times a week, and 200 food decisions a day is what's often quoted. You can still go through medical school and not hear the word nutrition in classes. You'll hear it in the public culture, and you'll get very confused in the public culture. Because for most people, including most healthcare professionals, food as medicine is just not a concept. If you don't get that, you're not going to say, why do I want to change my 2% milk to almond milk? Why do I need to? Either it's going to be the environment, it's going to be animals, or it's going to be health concerns. So we got to get some basic information in. And some people will just spark. I mean, they'll get it, but most have never, to this day, equated my plate and my health in a way that's really connected. So that's my first job. Doctors, nurses, physician assistants, the whole gamut of healthcare providers are still getting more information from CNN, Time Magazine, the internet. And we know that's a headline a minute of changing philosophies and changing diet ideas, and they're often monetary tied based on just this huge multi-billion-dollar business. I mean, the meat industry is going down, but it's going to go down noisily. It's unfortunate that patients are getting dietary advice from a healthcare team that largely has just not been asked or has chosen to self-school themselves. And I understand it. There's a whole lot to do to be a doctor, and to start reading nutrition books is seemingly not worth the time and the effort, but it obviously is very much worth the time and the effort. There are people that need to contemplate quitting smoking, getting fit, and changing their diet, but they won't. They're not ready. We all have relatives like that. Very often they could be, people we're married to, or parents, or brothers and sisters, and they're just not ready. You got to wait for a tragedy, or wait for, you're never a hero in your own town kind of thing. It's not going to come from you. And then there are people that are skeptical and people that are, semi-open. And then I'm always impressed. I'm so overwhelmed by patients who come to me, and just realize they had a need. It could have been a medical emergency, like a heart attack, could have just been an awareness. The biggest resistance, though, still to me, and I'm just so frustrated by it, is actually hospital systems. If you asked me who could drive change, not just to plant-based foods, because we're seeing that, but in terms of healthy dietary choices, the hospitals should be where this is happening. Medical schools too, but you should walk in a hospital as a guest to see your family member, as a patient, and as an employee, and the tremendous burden of overweight nurses and residents and stressed out physicians and the whole thing. It should be the laboratory to say, let's see if the public can actually embrace healthier eating. Irony is, there's actually medical science. You eat one hospital burger and it causes within an hour a deterioration in your health and your artery function. These are scientific studies that have been done, they're published. It's true whether it's a Egg McMuffin, sausage patty type meal. Within an hour, your arteries are stunned and don't work well. And that's what patients are getting in the hospital, and it's probably a detriment to their health acutely as well as obviously in the long run. I have probably the most dramatic model I have in my office, a 5-pound log of fat. To give an example, you pick it up and it's somehow heavier than you'd think 5 pounds would feel. And it just does not have a good look. And you talk to a person that's 25 pounds overweight and you say, our goal is to get 5 of these logs burnt off your body. It's a very powerful visual